Good morning. This is the Board of County Commissioners Board of Work session. This is a regular meeting. It is Thursday, January 26, 2023. It is 9:03 a.m. This session is set to go until 10 a.m. This is a hybrid meeting. We're at the 3000 Pacific Avenue Southeast, room 110. For public virtual attendance, you may follow along on the Thurston County YouTube channel. I'm Carolina Mejia. I'm the chair of the board. Vice Chair Ty Menser joining us via Zoom. Commissioner Gary Edwards to my left. Also in the boardroom, we have Ramiro Chavez, our county manager, as well as staff from Public Health and Social Services. We're having a Thurston Thrives briefing, and if we can have staff introduce themselves, and then we'll have our guests introduce themselves afterwards. So I'm going to start with.
Good morning, Commissioner Mejia and Commissioner Edwards. My name is Chris Hawkins. I'm a program manager with Thurston County Public Health and Social Services and have been a longtime staff person to the Thurston Thrives effort.
Kurt Harden, Kurt Harden, Interim Director for Public Health and Social Services and the Emergency Services Director as well.
Good morning, Commissioners. David Bain. I'm the Director for Public Health and Social Services.
Good morning, Commissioners and everyone. I'm Gretchen Toller, and I am the Division Director for Community Wellness. I work with Chris.
Good morning, Commissioners. David Shafford with the Thurston Chamber Foundation and the Chamber.
Good morning, everyone. Josefina Magaña, Director of Thurston Thrives.
Good morning, Doug Ma with Thurston County Chamber of Commerce Foundation and Thurston Thrives.
So thank you, Commissioners. We wanted to have this briefing and I appreciate the Chamber comment and give a perspective related to Thurston Thrives. As you may recall, last year we had a conversation related to the contract that we have with the Chamber in which the county supports financially the efforts of Thurston Thrives. And so we're here and this year that we're planning to bring this contract for the board to continue the partnership. But before we get to that point, I think it's a great opportunity to hear some of the successes and perhaps some of the challenges that we have seen in the past year and maybe how we see the opportunities here moving into 2023. That's really the gist of it. Although the here says a decision is needed, the decision really needs to be done at your board meeting when we bring the contract for your consideration. Who's going to take the lead?
You ready to jump right in? All right, great. Sorry if I'm a little out of practice. I think it's been quite some time since I've been at a commission work session. Again, David Shafford with the Chamber Foundation. The Chamber Foundation has backboned, as in your staff report, you'll see, since Thurston Thrive since 2015. It aligns really well with our organization's mission and the foundation's mission of community stewardship and the foundation's emphasis around supporting BIPOC communities, specifically BIPOC businesses, youth and career engagement and career opportunities, and of course, now with Thurston Thrives with its new emphasis. When we entered into the pandemic, and we all had very busy lives figuring out which way was upward and down and sideways, Thurston Thrives, the foundation took that moment in time to start thinking about reassessing and looking at the emphasis of Thurston Thrives. One of the challenges Thurston Thrives has had since day one, since its inception, was the lack of a common agenda. If you're going to do collective impact work, you have to have common agendas to drive the conversations, the collective efforts of everyone who might be involved in touching the effort in a way that is visible and understandable. So the ship was turning into looking at how we close health equity gaps in our community. The color of one's skin should not dictate your health outcomes. And so as a community, how do we want to address health equity issues and supporting all communities in living very healthy and prosperous lives? I think it's important to note that within that, if you're helping communities that have disparities in health outcomes, you're helping the entire community in building up systems and opportunities for everyone to live healthier lives. So That ship turned last June. We hired Josefina to start carrying the new governance forward and carrying the new opportunities on how Thurston Thrives engages the communities in what we believe is a much more impactful and opportunistic opportunities for everyone to engage in how we're going to solve some very, very complex challenges, or if we don't solve them, how do we have impacts on them? So with that, I'm going to step away from talking and turn it over to Josefina. And I did want to note that Doug, just for reference, Doug Ma was instrumental in the support of turning the ship and working with all those that were engaged with Thurston Thrives, including the county, during that transition time, and still continues on at high-level work and creating high-level opportunities for Thurston Thrives in our community around health equity. So with that, Josefina, I'll let you drive the ship from this point forward.
Thank you, David.
Yeah.
Thank you. First of all, thank you all for being here and allowing us the opportunity to gather and convene and share a little bit of what we've been doing with Thurston Thrives and how excited the community is to move forward. But like you said, Ramiro, there's challenges as well. So that's why we're here and making sure that we look at those and solve them together. A quick agenda of how these can look today for us moving forward. If there are suggestions as to stopping points, please let me know as well. This is very new to me. So we're looking at Thurston Thrives and health equity focus. So why health equity? Second on the agenda, new governance structure. What are we learning, right, from the moment that we started to look at the new governance? Finally, what is the progress as a collective, right? And then next steps, what do we have next? So one of the first things that I want us to look at is we have a figure, right? And it says, what are the social determinants of health, right? What determines how healthy we are? Not only as individuals, but as a community, right? 40% of the factors that determine your health can be associated with your zip code. I want you to kind of think about that a little bit. And then we are looking at 40%. Yes.
To make sure that
Okay.
commissioners have the most current PowerPoint. Oh.
It seems that the PowerPoint that we had is a little bit different
Oh,
from
okay.
today,
Oh,
so
yeah.
give us a
Yeah.
second.
Get everyone on the same page here.
Yeah.
Thank you. Give me copies. I'll be following.
All right, go ahead.
Are we good or?
Sorry.
All right. Can you all see this slide right here? Yes, perfect. I think we can move to the movement of slides works. Oh, there, perfect. All right, so overview will be the first item. We'll talk about overview of Thurston Thrives, health equity. We've already kind of discussed it a little bit. The new governance, what are we learning, what's working, what do we have moving forward and that we're looking forward to improving, right, to put it in that term. Progress on health equity as a collective and the next steps. So that's what we'll be covering today. What are the social determinants of health, right? These are the foundations for Thurston Thrives. Looking at, is everybody in this community healthy, right? And we've discovered that not everybody is, right? There are disparities amongst different populations. Did you know that 40% of the factors that determine your health can be associated with your zip code? Right, so let us think about that a little bit as we walk through this presentation today. So why health equity, right? And what are some of the measures, like David mentioned, as a collective, we have a common agenda and measures. That's how we look at the progress over time. I think we're good to move to the next one. Yes, thank you. So one of the indicators that we are looking at as a collective is infant mortality rate. These figures are for 2014, 2018. As you can see here, unfortunately, Black babies disproportionately figure in this, right? Dying, right? The rates are twice as high as their counterparts. So that's very striking, right? Let's move to the next one.
Would you prefer questions during the presentation or afterwards?
I believe after would be better, but up to you as well. If there's spots that you feel that would be better. Yeah. And then we have the second measure that we are using, premature birth rate. This is for 2015, 2019. Babies being born too early, right? And we see here again the disparities, right, amongst the populations. On the next slide, we can see the third measure that Thurston Thrives is working on, and that is 8th graders experiencing depression, and this was 2021. We have Native 45% as compared to other counterparts, and Asian 36%. So we can see that here as well, right? I mean, high numbers are definitely not good, right? We want those to be low. The next slide, please. The last indicator that Thurston Thrives is looking at is fair or poor health amongst adults. These figures are from 2015 to 2019. So here, once again, we see the Black are at 18% compared to, for example, Asian counterparts that are at 8%. So, yeah. So how do we look at health equity, right? Looking at the different measures that I briefly have talked about. One of the ways that Thurston Thrive set out to do is how can we have a focus, right? How can we have different groups that come together, especially those that are already there, right? How can we bring them in the efforts of health equity? So the governance, when I started this position, the governance had just briefly been implemented at the beginning of last year. And when I joined, we quickly set out to look at this model. How can we work with this model, having the action teams be that core, right? Because that's how they got started. I'll give a little explanation of how each has been working, some of the challenges that we have faced, and how we hope to move forward with those as well. So with the data, could we go back to the last one? I don't know if there's a way. Yeah, I'll be spending a little bit of time on this one. This is a very key component of the way that Thurston Thrives is moving forward. We have the data group. We have convened twice. The first meeting, we presented the measures that I have shared with you. Several community members are part of this group. There's also a couple of nonprofits. There's school board members, just community members that really want to make sure that the data that we provide is insightful, but that they also, when they go back to their respective places, we're asking them, is this something that you're seeing, right? Are there differences? Are there similarities? What are you seeing where you work and reside, right? Which is this county. So that was the first meeting, and then we just held our second meeting this week. One of the main goals also as a data group is to actually look at trends, right? Are there different things emerging? How does the data change over time? Because as we know, when it comes to health, the way that we measure, right, a healthy individual is gonna be that over time, right? And this is a great time to do it and get started putting those numbers, right, and that data. We met this week with the data work group for the second time. We looked at some updated measures, the similar indicators, but they've been updated. There are still disparities, right? That was one key insight. There is good focus on youth. Both times we have met, the participants are very, very caring in that sense of youth, right? What can we do with our youth? Depression has come up, the use of drugs, unfortunately, as well, right? It's come up, and just trying to find ways of making sure that our youth grow up in this healthy community, right? Next, we have elected officials. We met last year in October. We are set to meet again. I'm finalizing dates, and that will most likely be in March. The first elected officials meeting in October was in person. We had great turnout from different jurisdictions. We had the opportunity to have great discussions. We share the data as well with this group, and it just really allowed people to come together and have that opportunity to have those conversations, right? That normally we've had a lot of virtual, but just the opportunity to show them that Thurston Thrives is moving in a new direction was good as well. Well, funders committee, those that help, right, contribute to Thurston Thrives. We have met once and we are scheduled to meet again. One of the key important things for this initiative is how can we have resources, right? How can we find resources to move these important efforts? And gathering with that group will help us and give us an idea of how we can do, right? Like what's being provided, what are we seeing, what do we need, right? And then finally, within that circle, we have the coordinating council. The representatives of each of the action teams. We have gathered 3 times in the past 8 months. And initially, we were looking at how do we focus the work of the action teams with health equity, right? How do they align? This initiative has existed for a little bit, right? So how do we do that work where the action teams can still do their own work, but we align it with health equity? So we've spent a few meetings having those discussions that I think are essential before we can move forward. We are set to meet in March as well with that group. And then finally, the action teams, right? Each of the action teams that is doing their own respective work, but as a collective, how do we come so we can move forward with health equity? So if we move to the next slide, this is how the action teams look at the moment. I will give opportunity for Chris and Gretchen if they want to share about their respective action teams. I think that they will do a good service. So we'll take a little bit of time so that they both can share. I don't know who wants to go first.
Great, thank you. Again, Gretchen Toller, Thurston County Public Health and Social Services in Community Wellness. And Commissioner Mejia and I both host the Partners for Children, Youth, and Families Action Team. Thinking back on 2022, I feel like we had a pretty busy year. We had I think almost a full day retreat in the spring of 2022, in which we really tried to kind of refocus and reground ourselves. And hearing from the members of our group, one of the things that was really standing out for most of us is child abuse and the need for child abuse prevention efforts in our community. We have seen the rate increase since 2015 consistently. The last data source we have, unfortunately, is 2015 to 2020, and there's been a 34% increase during that time. We know just from many of us working in the field that the severity and the rate of child abuse seems to just be going up, although we don't have actual data around that yet. But there's been some pretty significant, unfortunately, child deaths and other things in the community in the last couple of years. So we know it's been challenging during the pandemic. So out of that meeting, we identified some of our goals and our areas of high priority. Child abuse awareness and prevention was right there at the top for many of us. We're also, continuing our work just on other areas that, child abuse prevention is going to impact infant mortality. It's going to impact child mortality. Ultimately, it's going to, if we prevent child abuse, likely impact the number of 8th graders that are experiencing depression, 12, 15 years from now. So some of the other things we did, we're working on bringing on additional community members, such as healthcare providers. We've brought on a business owner. We're hoping to have CPS staff join our group at some point as well. We were able to identify needed data and then review some of that local data, which was helpful and helping us to understand more of what's happening in our community. Our prosecuting attorney's office, Christy Peters and Tara, I'm forgetting Tara's last name, they are also working on gathering data from their end around child abuse, and that will also help us know where we can do more work, hopefully, and have more impact. One of the other areas, too, that Commissioner Mejia and I were bringing up was around the formula shortage. We know that was a huge stress for parents and families. So based on those conversations, created an initiative, and the Board of County Commissioners, I want to say, used ARPA funds, is that correct? Okay. Used some ARPA funds, and we went into a contract with Thurston County Food Bank. They were able to get formula out to families. I'm still waiting for the number of families that have been served, but with the formula, the funds, they purchased 5,142 cans or bottles of formula, and then over 100,000 diapers were purchased to go out to families. So that was part of that work. And then finally, in the fall, we set goals for our Partners for Children, Youth, and Families group for 2023. These goals include, one, performing a child death review meeting in the first quarter of 2023. That is a position that we have with Foundational Public Health funds that we are actually just interviewing for this week. Hope to have that up and running here soon. Based on doing a child death review, you'll pull out data, and that data hopefully will help us identify again where we can implement some strategies in our community to hopefully mitigate any future deaths. And then the other one is identifying public health messaging strategies for child abuse awareness and prevention, which again, hopefully that will come out of that data. But we are eager to get more messaging out to our community around preventing child abuse, because it just seems like it's not something that's being talked about a whole lot, and our rates are continuing to go up. So those are some of our accomplishments for 2022, and we have a meeting again this afternoon. We hold monthly meetings, and we're pretty eager to move some of these initiatives forward. Anything I missed? Okay.
So I work on, Chris Hawkins, Program Manager with the Health Department. I work in support of specifically the community design area of Thurston Thrives, and commissioners have heard me talk about this at length in other venues, so I won't elaborate a lot on our efforts of 2022, but I did want to say that we had a great opportunity during 2022 when we were awarded a place in the Walkability Action Institute. State Department of Health put on this opportunity with the National Association of Chronic Disease Directors, and we were given one of 4 seats among Washington state counties to be a part of that. So that was our opportunity to have sort of a more lengthy exploration and conversation amongst action team members around what we can do to boost walkability around Thurston County. And that is to make it easier for people to go for a walk, to be supported and safe in doing so, and thereby have those opportunities for daily physical activity. So we were very fortunate to be a part of that, and that resulted in the formation of an action plan to work together on that, with a focus on the urban area in northern Thurston County, where there's a lot of housing being built and a lot of opportunities to better connect people with walkable environments, whether that be a trail, a park, some other recreation or destination in the community from where they live. And so we're working hard on that in collaboration, mainly a focus initially on the city of Tumwater. We had engagement in our action team from both staff and policymaker level in the city of Tumwater. And so they were willing to step up and be a part of that planning process with the Walkability Action Institute, and have invited us to provide some comments and recommendations towards their update to their comprehensive plan, for example, but also just to inform them of opportunities that are in that urban area for making short path improvements to get people better access by walking to those destinations in their community. So we're already seeing, Tumwater's have been a longtime partner in this, and they're already, as our city of Lacey, city of Olympia, and other parts of Thurston County, people making investments, cities and local governments making investments, including Thurston County, in the trail system, and creating better access for people to it. So we're seeing a lot of improvements on that. So that was a big focus for us in 2022. We also, of course, were revisiting how we connect to that North Star of Thurston Thrives, which is health equity. What are the populations who are maybe experiencing a disparity in physical activity? So we are reviewing that data to see where we can make a bigger difference here in the community. And then finally, we did some communications work around sharing the trail well. So in collaboration with the Thurston County Public Works Department, who did a great job of crafting some materials, we were trying to get the word out to trail users about how to respectfully share our trail system so that there are fewer conflicts and people can enjoy that together. And it's great to see the increasing use of the trail system, because that's ultimately what we want to see happen, is that more and more people get out there and be active and be recreating regularly. So that's just a quick update on our 2022 efforts. We're looking forward to continuing the work to implement that walkability effort in 2023. And with that, I'll turn things back to Josefina. And I just want to say,
Madam Chair, can you hear me?
I can hear you. Can you not hear Commissioner? Commissioner Menser?
Can you hear me?
Now I can.
Yeah, we can hear you. Can you hear us?
Oh, I can. Yeah, I was hearing everything. The slides were not advancing for me. And based on what I was looking at, I don't know if that's a problem on my end, but I do have to step off for the Salmon Recovery Council meeting. I meant to say that up front. Apologize to our guests. I will catch up on the back end of this briefing online and watch the tail end. So I do have to step off, but I appreciate everybody's presentation. Thank you.
Thank you, Commissioner Menser.
yeah, we hadn't advanced on the slides. I think you guys were in the right place for the
Yeah,
which slide we're on. Thank you.
Close on that one.
Yeah, so I think Josefina has a couple other action teams that she
Yes.
wanted to speak to, but I just wanted to say that there's also been sort of, each team does its own sort of collective impact, looking at its own data and measures and working according to those strategy maps that they have developed. And so it's a sort of a collection of collective impact, and we're really happy to have the support of Thurston Thrives, because they're also looking at sort of those broader systems level changes that need to happen in the community that maybe affect multiple teams. So with that, I'll turn it back to you, Josefina.
I'll share briefly just a couple of the other accomplishments from the other action teams. I do have a lengthy list, but I want to make sure that I honor the time and that we have time for questions and discussion. We have a key one is that clinical care. It was reconvened. It had been dormant for a little bit. We have engaged area hospitals, CEOs around health equity gaps and community needs. Encouraging data sharing and increased support of midwives for BIPOC mothers and communities. And a couple of the efforts that we are looking at moving forward for this year with this clinical care group is a focus on women's health and pre and postnatal care, especially for BIPOC communities. We are also looking at behavioral mental health, which is an emerging area of collaboration for cross-sector efforts. And then one of the efforts that this might be a good transition as I talk about some of the efforts that are new, right, this past year. We are looking at how can we do collective systems change efforts through partnerships. I think that's a beautiful thing that I realized about this community, how much it cares, right? But we do need those partnerships. The beauty of this collective is that it is private-public, right? So we do have the ability to bring the community together as well. One of those partnerships that we've been working on is with Kaiser Permanente. We are working on at the moment, we started working on an assessment with the community and with different organizations. Several of those are BIPOC organizations, smaller organizations. A few of them actually emerged during the pandemic, so it's good to know that we're out there trying to make sure that they know the resources that exist in the community. With Kaiser, we've looked at what are Unita's platform, and this is a platform that actually allows organizations to use that as a referral system. And we've actually learned quite a few things since we started this project in August. We are gonna set up a community advisory board. We're gonna learn a lot about information exchange, which is kind of the tenet for this platform. Building a network.
You want to advance the slide to the one that's
Oh,
talking
yes.
about
Yes. Oh, perfect, thank you. So with that, Kaiser, we have several meetings lined up in February to bring different organizations. Several of those already have that platform, so it will be a great learning experience to learn what's working, what's not working. Not only that, but it will inform us as I do outreach, right, for other organizations. Is this something that perhaps they are interested? Does it work for their organization, right? A lot of it has to do with staff time. Some of these organizations are small. Do they have enough people? How much is it gonna cost, right? Privacy. We're learning all kinds of good information about what it is that organizations, smaller ones specifically, need at the moment. With that one, it's a phased project. We are in the first phase. All of the work that we're doing right now will inform us into, is there a work plan? Can we actually deploy a small number of organizations? So be on the lookout for more information to come as we continue the project and gather more information with that partnership.
Actually, Josefina, if I could add
Yeah.
some additional information here. So this is, again, is something that's new from the last time we were here speaking with you. It's a $325,000 grant from Kaiser Permanente. The grant, as Josefina had indicated, is broken into two parts. The first phase is to assess the readiness of the community to engage and deploy in a community information exchange platform. Kaiser, along with other healthcare providers, have a really strong interest in seeing how they can refer clients to fulfill needs that they are not able to provide for themselves. And this information exchange is one way of doing that. The grant, again, $325,000, $200,000 of that is dedicated to deployment with nonprofits. So it becomes a pass-through grant through Thurston Thrives to organizations that are ready to adopt and deploy a community information exchange like this. Now, at the same time, not every community is capable or able to stand up a network, a referral network like this. And what we have learned from King County is a lot of times it's beneficial if you have an advisory group that can talk about the network, that can understand how connections are being made. The interest of the advisory group is to find out just how ready we are, whether it be Unite Us or some other platform. The platform itself is also tied back to the efforts from the Healthcare Authority and their efforts to stand up and adopt a platform or series of platforms that are interoperable to do just this type of work. So not only is this a grant to move forward the interests of Kaiser Permanente, it also builds on our ability to understand and connect organizations and people. It fits into a larger community, the accountable communities of health transformation efforts occurring at the state level. That also ties back to the next bullet on the slide, which is our contract with Cascade Pacific Action Alliance. We are anticipating a $40,000 grant from them to do the work that is complementary to the efforts that we're doing here with Thurston County. So it enables us to do additional convening, additional outreach, and also provide additional training. You'll recall that last year we received a small grant from CPAA to do equity training. That was pretty well received. A lot of Thurston County employees actually participated in those equity training sessions that we held. So we'll be able to do more of that. The other thing that CPAA is planning on releasing here in the very near future is a $500,000 allocation of funds dedicated to addressing equity and health equity in their service area. So we believe that Thurston County is well positioned to be very competitive in that grant distribution. They're still developing it. We don't know if it's competitive or if it's going to be a formula-based grant. Me personally, I'm kind of hoping it's formula-based because just based on population, Thurston County would do very well in that particular situation. But all of these efforts, which did not exist last year, but have been undertaken this year, leverage the dollars that Thurston County has contributed and also fit into the larger regional and state level efforts to address overall health within communities, but also the overall efforts around eliminating health disparities and inequities in our healthcare system.
Thank you, Doug. Yes, and lastly on this, I want to mention the birth center. They are, one of our measures, right, is we're looking at infant mortality rate and premature births, right? So building partnership with those organizations that focus, right, that have those focus. We wrote a letter, Thurston Thrives wrote a letter for them. They applied for the Birth Equity Project grant with the Department of Health. They are awaiting the response. I believe they have not heard yet, but we're just wanting to build partnerships with them. They also offer trainings. I believe they have one coming up in May or June. So Thurston Thrives will be supporting them as much as we can with that as well. So those are the key highlights of projects that are happening that are different from last year that will continue to move forward this year as well. Next slide, please. All right, data over time. I will not go into detail with these slides. We just presented them at the data work group. They are reminder that we are, as an organization that's doing collective work, that we are looking at data over time, right? Are there still disparities? Are there still the gaps, and where are they, right? So I won't go into detail with this one, but I just wanted to share that since we just started looking at the 4 measures, we have gone on to updated measures as well. And I want to take a quick side note and thank Mary Ann Ogaro, who works with the county as well. She's been instrumental in helping this group as well, the data work group. If it wasn't for her with the data, I don't know how we would do it. So, but yes, I just want to briefly go through these slides. I won't be talking about them very much. If we can move to the next one. Thank you. So now, who funds Thurston Thrives, right? I want to acknowledge once again and thank those supporters and funders. Thurston County, of course, the Thurston County Chamber Foundation as the backbone, the Community Foundation of South Puget Sound, United Way of Thurston County, Cascade Pacific Action Alliance, and then Kaiser. Some of the upcoming meetings that we have, the goal as we move forward, I'm actually excited because we have started the year on the right foot, I believe. We already have several meetings that have taken place, and we are set out to do more convening and gathering, which is one of our main goals as a collective organization. Like I said, we have the convening of Kaiser Unite Us in February, and then elected officials in March. And we'll continue with that cycle of that model that we looked at earlier today. And with that, I believe that is on my part, unless David or Doug have anything else to add.
We're really glad she's on board.
So is the funders meeting today?
We have a tour. I have updated to be a tour and then a funders meeting
okay, got
later,
it.
yes.
But we have some absences, so
Yes.
we're trying to, I think we need to reschedule that.
Wanted to make sure we had a group for the next meeting.
County Manager Chavez is the
Yeah,
representative of the county on that.
to give a tour of the 3000 Pacific.
We are looking forward to it.
Okay, with that, I will open it up for questions.
You listed some of your funders. Is there any way that we could see, or you could just tell us, well, this so much, so much, so much, so I get some sense?
Yeah, going, not with anything in front of me. Let me see if I can get part of this right.
You had the slide up there, but it just didn't have dollar amount.
Yeah, so if we just look at, and the annual budget will change a bit, it's about $110,000 annual budget, okay? Of which Thurston County is roughly 1/3. The Chamber and its foundation contribute both monetary and other resources, collective resources, to about $25,000. Some of those end up being in the budget. Some of that does not, because some of it's in kind, so we don't account it for it that way. Then we have Kaiser, which is a significant chunk this year in this budget. I think it's right around 100, what was it, 65? 75. Now, I want you to be a little careful as we're crossing calendar years and fiscal years, so the math will get a little wonky on you, but I'm just giving you kind of the perspective depending on which months you want to count. And then, who am I leaving out? Cascade Pacific Alliance, they've recommitted this year, and last year I can't recall what they were.
And it's increased. Last year it was 10, and
10.
it's increased this year to
To 40. Yeah.
CPAA is essentially matching the county at 40. And again, the two efforts align themselves nicely.
We'd be happy to provide you.
That's fine, no.
Okay, well,
Uh,
I know that's a little disjointed, Commissioner, so,
That's fine.
but happy to, if you want it.
And then, was it Kaiser that's doing the 325? And then some of that's gonna go to nonprofits,
200,000 of the 300.
kind of almost a pass-through
Yes.
situation. And when you were asking us for money, was that supposedly gonna be out of general fund?
It has been for the last few years, general fund, and it's part of the base budget that you approved.
What, are we hesitant to do something with ARPA funds? I mean, this sounds like this fits ARPA.
This has been an ongoing effort, and our funds wouldn't qualify for this, Commissioner.
Can I ask a follow-up?
Yeah,
to
yeah,
your
jump right-
question?
jump right in there.
I'm wondering about foundational health. Does it qualify for?
The foundational public health, we need to probably look at the possibility. It may be a nexus on that. But again, the budget that you approved includes on the base budget, the 40,000 from general fund. That has been a contribution, so.
Well, I'm always trying to save
Yeah,
money.
I
Oh,
know,
I
it's like, I
understand.
was like, anything that, I see
I
that.
understand.
Yeah, I would like to see if,
Yeah, we'll
if
look
there's a
and see what's
nexus with
allowable.
foundational
Yeah.
public health, I mean,
When we bring the contract for your consideration, then we'll probably have the answer as to what color money we can use.
Do we have actual comparisons? Okay, so we've been doing this now for 7 or 8 years, I guess, 15, 16, somewhere in there it started. And do we have past successes? So we knew what it was sometime back possibly. And now we've really, this success is, I don't know, lower infant rate of death or, better health outcomes. I don't know, like the state's trying to do, nobody has to buy school lunches anymore. They're trying to get some stability there. So I see where it ties in to other things, but it almost sounds like we had some severe questions last year about what the benefit was. And it's almost like that might have been a pretty healthy position to take to try and get some real outcomes some tangible outcomes here that we can really look at. And it almost is like we're getting really started right now to get that stuff all put together that maybe we were taking for granted before.
So collective, a couple things. Good question. Collective impact is often a challenging, especially as broad as Thurston Thrives collective impact effort was in the past, to create your bottom line. So you ask the question, what are your measurements and how are you tracking your success? Well, in the past, we said, well, what's been the overall health of Thurston County? And we've tracked it that way. Really, Thurston Thrives tracked its success by the types of activities and work it was doing through the action teams. And of course, a couple were reported on. So that's what we would view as efforts in those emphasis areas as a measurement of what we are doing with the resources. When we made the shift to narrow the agenda, to narrow the focus, to narrow the data, which is Thurston County data and create a much more direct link to how Thurston County is, one, measuring and gathering its data, and two, how we want to have impact. I think, Gary, you are correct in saying, yes, the starting line was June of last year. And now we're moving forward with both the governance on trying to create the greater collaboration so that we can see outcomes on those 4 measures that Josefina walked through. So, challenge to give you the bottom line in the past, striving forward, looking at bottom lines into the future, as well as how it informs decisions, both policy-wise and future resources that we're spending as a community, as individual organizations, and as local governments. I hope that helped a bit. Okay.
Thank you. So kind of following up on that trend, right, of data, I'm seeing here, right, the premature birth rates for Thurston County, the initial numbers that were from 2015 to 2019, and now the updated numbers from 2017 through 2021. We see kind of a change in those numbers, and we even see a flip between Black and Asian, and how they kind of switch places, and we see a dip and just the overall numbers. But I know COVID has a big part to play in that, and so I'm wondering about, you know, even though the numbers look lower, is it because of reporting rates? Is it because data wasn't available during those times, or data was skewed during those times just because of the pandemic? And is this something where once the 2022 numbers come up, we're gonna see an increase in it? And is it gonna be, you know, is there that expectation that we're gonna see just a big bump up or even a switch in those stats?
Yeah, I think, so speaking for Marianne, who's obviously the subject matter expert here on the data and data collection and reporting, part of the reason why you have some of these kind of this wonkiness in that particular measure is because we aggregate the data so that you protect and ensure confidentiality for those that are reporting. Infant mortality is still, it differs by race. Relatively speaking, it's a very rare event still. So these are small numbers that we're looking at, and which is why they're aggregated over the year, and why, if the numbers are so small, that they aggregate them in by
5-year period, yeah.
by racial categories as well. Going back to the issues around the data, though, again, there are a number of data points and data elements and variables that you could use to assess the overall health of your community. We identified these 4 because they resonate with people, and they are kind of leading indicators. If we make changes around prenatal and infant mortality, specifically around closing the equity gaps, we know that we're making meaningful changes across the entire continuum of a healthy community. So these are just one indicator. We could bury you with lots of data, but they will all probably point to the same thing, which is that there are disparities between how the overall outcomes for individuals by race. So to get back, that's why we're seeing some of the wonkiness in the infant mortality. Not quite sure what 2020 is going to show us. Maybe Marianne has some insight there, but I think they're still probably collecting and finalizing the vital statistics for 2022.
Thank you. I just wanted to add, our infant mortality rate for Thurston County it's been high for many years. I mean, overall, it's been higher than the state average. You know, long before even this data was put out by Marianne, we were noting that it was higher than elsewhere. I will be pleasantly surprised if the numbers don't look worse in the next couple of years, because it's been a rough few years. I will say, in Nurse-Wide Partnership, we're getting referrals for clients really late who have not had any access to prenatal care. And I mean, we're getting referrals like a week before they're due or something. So I would expect that numbers will look worse. If they don't, that's great. The other thing to factor into it also is, sometimes when there's a high-risk mom, they will deliver up north, so they won't be counted in the Thurston County data. So that's just something to think about too, is some of the really high-risk moms, we're sending them up north for prenatal care and they'll deliver up there.
You know, let's say 10 years ago, the drug overdose deaths in the last 10 years, I mean, it is absolutely crazy. You know, I'm gonna just take a guess, maybe 10 years ago it was 10 community per year. Now we're over 100. And those are deaths. How many of those bad situations were not deaths that contributed to some of the issues that you're referring to now? And are those folks relatively newcomers to our community, and that's why they're not aware of any of the services that you've provided in the past? Are they just showing up and they're adding to our deteriorating situation, I guess? I mean, so many of the people in the hospital plugging it up, the emergency room, everything is kind of overloaded. And that's why, I mean, when you say you'd be surprised, I'd be really surprised if it doesn't go up considerably because of numerous different factors. But it's not all, we can't fix everything that's coming upon us from elsewhere. And I don't know how that figures into this.
Yes, I mean, there's a great need. There are, I mean, definitely, we see individuals that are new to the community that maybe coming here to leave a violent situation elsewhere. Maybe
Yeah,
here,
I never know.
you know, whatnot, but yeah, there's, I mean, a fair amount. I think the other challenge is, and this is just across the board, it's hard to access care. I mean, you can have great private insurance and you're struggling to access care. So it's very challenging. And then
we're gonna be getting a briefing here sometime in the near future,
It's already scheduled, yes.
you know, stemming basically from the presentation at the EMS Council.
Right,
You know,
it's scheduled. I don't know off the top of my head when it is, but it's already scheduled.
and this is just probably a reflection of what we're seeing there, I suppose.
if I can add something to what Josefina was saying when she said the 40%, looking at the zip code, I've been to a number of public health trainings and looking at birth outcomes, and they, over and over again, the message has been the number one predictor of that child's health as an adult, doesn't matter, doesn't matter what health behaviors they have, it doesn't matter genetics, it matters on the zip code of where that mom lived during her pregnancy. Over and over again, epidemiologists have said that. It's the number one factor. So it's something to think about. Just, I mean, things are happening with that baby in utero that are going to impact that child later in life and their health. And I mean, just a lot of people we can't unfortunately, see everybody with home visiting or anything. It's a small percentage, but it's just a factor to think about. I mean, there's so many other things that fall into that, economics and safety and.
But we really don't even have true data when it comes right down to it. You don't know where was the first 6 months of that pregnancy spent, so.
Well, I think it has a lot to do with like health equity. I mean, really at the baseline of it, my experience, right, with my first daughter is my first daughter was born prematurely. And it was because I, thought I was having early contractions and I went to the doctor. I think I went to the doctor 5 times before they even found out it was a kidney infection, and I kept getting turned away, and instead, I was in law school during that time, so my care throughout pregnancy was where in between whenever I could squeeze in. And so since I didn't have that huge tracking, they just assumed that it was alcohol-based. And, you know, they kept sending me away. 5 times they sent me away before they found out it was actually a kidney infection that was now leading me into, you know, giving birth a month earlier than I was initially set to. So I think that health equity has a big part to play in it. I truly believe that. You know, just as it was very, you know, upsetting for me during that time. And I just didn't know how to defend my rights either, right? I was
So
young.
it basically went from a problem that could have been solved
Solved
early
to-
to an acute situation.
To an acute situation where,
Because they weren't paying attention.
Yeah.
Yeah,
and
I can
it
see
be,
that.
and, you know, it became a high-risk birth during that time too. So I think there's just a lot of factors to really play into all of this. And I know our medical system right now has a lot of factors that play into it. There's the level of care just to get an appointment right now, it's 2 to 3 months out for people. And I can't even imagine for, you know, women who are currently, you know, or people going through pregnancy that are just even struggling to get an appointment and they have a high-risk pregnancy to start off with, how difficult it might be for them. So I think it's really interesting to kind of see the numbers. I'll be really interested to see the numbers once, you know, kind of as we get off this pandemic and kind of see how they relate to everything. And okay, with that, I know there is a decision point, but I also want to be respectful that Commissioner Menser is not here, and I
No,
think,
I won't be asking to make a decision today. We'll bring the contract, and then at that time, we'll have the opportunity to make your decision. But if you allow me to give a little bit of a perspective, I think what the board is asking is absolutely on point. You know, what is the investment and what are we getting out of that investment? Are we seeing some of the rates getting lower? And I think those are the performance indicators that anybody who invests on anything will have to see a benefit at some point. But I'd like to go back to, you know, back to June of last year. And fundamentally, Thurston Stripes, the structure changed. And Josefina came and started implementing that change. And in slide number 8 that you have in front of you, I believe is pivotal of what that structural change really means. Because before, it was a funnel of all the action teams getting into the Thurston Thrive Coordinating Council. Now what we have done is we have embraced all the action teams into how they can probably be more effective. And now we see the benefits that the structure funders are coming, and although the finite and resources they provide, but the structure itself, I believe, is going to be intentional in targeting as to how we're going to start addressing this. Data collection is first, and that's what you see today. And obviously, we need to, at some point, we need to see how the performance indicators, what the performance measures will be. And that's how we measure time and effort. So you know, if my humble perspective, I think this a tremendous effort. I think we have moved a long ways from where we used to be in 2019, 2020, to be honest with you, because Thurston Thrive was just having a slow death, and that's what we're facing. And I'm glad that you took the initiative just to see how the structure can change to be more effective. So that's all I have to say. Yeah, we'll bring a contract at some point and start your decision. At that point, we'll see if additional public health might be an avenue to
I
fund it.
would really like to explore
Yeah.
that. And the other thing is, I think this is applicable to the Board of Health. They ought to be aware of this.
Yeah, we can actually schedule a presentation. Usually, there is a presentation through some stripes to the Board of Health. That would be a great idea.
I mean, just
Yeah.
because that's what it's all about when it comes right down.
But financially, the board needs to take connection on
I know.
that.
But
If I could just keep your eyes open for the elected officials convening. I think the first one was exactly what we wanted. convening, which was generative conversations from public policymakers in our community around real critical topics. And so that will occur once again. So it won't be a report out, it'll be a little bit of a reporting, and it'll be all about conversation. So that within your spheres, you can be grounded on where we should be heading.
It's kind of frustrating that we're dealing with hundreds of millions of dollars and we're squabbling over 40,000 or something because we don't, it seems like we're not truly investing what we should be investing, but we don't ever have enough money.
Yeah, the problem is big, but I think is being intentional is, I think, a good first step.
Yeah, I do too. I think this was great. I hope we'll see more of this type of information as it becomes available. And
Thank you.
Thank you.
your story slays me. That's even more reason that I kind of look to you. You know, I've never been
With that note.
Although the new thing, they say that that's possible. I don't believe it, but.
Well, thank you all for coming and thank you for this presentation. We will be having more discussion with this. It is 10:03 a.m. You're adjourned.
Thank you.
Thank you.